With the onset of the monsoon, there has also been an increase in the number of mosquito-borne illnesses, including dengue and chikungunya. This season in particular, there has been an unprecedented increase in the cases of chikungunya all over India.
Delhi alone has seen 300 cases so far. Now almost all patients recover from this disease, but its symptoms can be disabling. So it is important to recognize the symptoms early and, more importantly, know what steps to take for preventing this illness in the first place. I am Dr. Sonyalal Gupta.
And I am Dr. Sameer Gupta, and welcome to Doctors on Call. Today, let's look into chikungunya. Chikungunya is a viral infection transmitted by the bite of an infected Aedes aegypti or Aedes albopictus mosquito. These are the same notorious mosquitoes that transmit dengue, Zika and yellow fever. The infection usually lasts for 7 to 10 days. Most people bitten by the infected mosquito will get the infection. The symptoms usually last for 4 to 8 days after getting bitten and most commonly include fever up to 104 Fahrenheit or 40 degrees centigrade that can last for 3 to 4 days. Severe joint pains, usually hands, wrists and ankles. Sometimes pain extends to other joints like the back and knees as well. The joint pains can be very severe and disabling. Typically, the joint pains last for a week, but in some cases, these joint pains can last for weeks to months, causing severe disability. Some cases might also have long-term joint pains for years and years. Rash. Usually 50% of the patients also get a rash, typically seen on the face, arms, legs and back. The rash usually begins with the fever and can last for a week. Headaches, myalgias or muscle aches, fatigue. Very young children and the elderly are more prone to rare but serious complications like meningoencephalitis, which is a swelling of the brain, pneumonia, an infection of the lung, and should take extra care. Now, chikungunya can be diagnosed with a simple blood test called ELISA that can help detect antibodies. The problem is that sometimes these tests come positive at least 4 to 7 days after the infection. Hence, another test called PCR is also available and can help detect the virus in the first 5 days. There are no specific antivirals or vaccines for this infection, and treatment is primarily symptomatic, but treatment is directed towards relieving joint pains and fever. The symptoms are often difficult to differentiate from dengue. Hence, it is important not to take any non-steroidal anti-inflammatory drugs, also called NSAIDs, like aspirin, diclofenac and ibuprofen, till dengue is ruled out, as these medicines can cause the platelets to fall in dengue.
The best way to prevent chikungunya is to avoid being bitten by the mosquitoes altogether. Unfortunately, there's no other solution at this time. Both varieties of mosquitoes, the Aedes aegypti and the Aedes albopictus, breed in clean water. While the latter is more outdoors, the Aedes aegypti mosquito is mainly an indoor mosquito. Mosquito repellents play a big role in helping protect us from mosquito bites. The WHO recommends repellents containing DEET, IR3535 or Icaridin. The Center for Disease Control, or the CDC, has deemed DEET containing repellents safe to use in anyone above 2 months of age. Please remember to avoid putting it on the hands of very young children, as they might put their hands in the mouth. And please do not apply it on any cuts or wounds. Concentrations of DEET above 30% do not give any extra benefit. These mosquitoes are active during the daytime, especially early mornings and late afternoons. So please take extra precautions during these times.
If someone ends up with long-term chronic joint pains after this infection, please do speak to your doctor, as there are different medications that can be tried to relieve the pain.
Just remember, prevention from mosquito bites is the best solution. See you next week.